HIV and genital herpes are two distinct viral infections that affect millions worldwide. HIV, or human immunodeficiency virus, attacks the body's immune system, weakening its ability to fight off infections. Genital herpes, caused by the herpes simplex virus, manifests as painful blisters and sores in the genital area. Both conditions can be transmitted through sexual contact, and while treatable, there are no known cures for either. Understanding the differences and similarities between these infections can empower individuals to prioritize their sexual health. Early detection and prompt medical intervention are crucial for both HIV and genital herpes. Testing is the only definitive way to determine if you have contracted either virus. By understanding the basics of these infections, we can work together to reduce stigma and promote a culture of safe and responsible sexual practices. HIV is primarily transmitted through the exchange of bodily fluids such as blood, semen, vaginal fluids, and breast milk. This can occur during unprotected sexual intercourse, sharing needles, or from mother to child during pregnancy, childbirth, or breastfeeding. Genital herpes, on the other hand, is spread through direct skin-to-skin contact with an infected person. This usually occurs during sexual activity, but transmission can also happen through kissing or touching if there are active sores present. It's important to note that both viruses can be transmitted even if there are no visible symptoms. This emphasizes the importance of regular testing and open communication with sexual partners. Practicing safe sex by using condoms consistently and correctly can significantly reduce the risk of contracting both HIV and genital herpes. Symptoms of HIV can vary greatly from person to person. Some individuals may experience flu-like symptoms, such as fever, headache, sore throat, and muscle aches, within a few weeks of infection. This is known as the acute stage of HIV. However, many people may not show any noticeable symptoms for years, even decades, after contracting the virus. This asymptomatic period can be misleading, as the virus continues to replicate and damage the immune system silently. Genital herpes, on the other hand, often presents with more localized symptoms. Painful blisters or sores may appear on the genitals, rectum, or mouth, often accompanied by itching, burning, or tingling sensations. Flu-like symptoms such as fever, headache, and swollen lymph nodes may also occur, especially during the first outbreak. While these symptoms can be treated and managed, it's important to note that genital herpes is a lifelong infection with the potential for recurrent outbreaks. If left untreated, HIV can severely damage the immune system, leading to a condition called AIDS, acquired immunodeficiency syndrome. AIDS is the most advanced stage of HIV infection, making individuals highly susceptible to opportunistic infections and certain cancers. These opportunistic infections, which rarely affect people with healthy immune systems, can be life-threatening for individuals living with AIDS. Pneumonia, tuberculosis, and certain types of cancer are common opportunistic infections associated with AIDS. The good news is that with early diagnosis, consistent medical care, and antiretroviral therapy, people with HIV can live long and healthy lives. Antiretroviral therapy is highly effective in suppressing the virus, preventing its progression to AIDS, and reducing the risk of transmission to others. Regular medical checkups, adherence to prescribed medications, and maintaining a healthy lifestyle are crucial for managing HIV and ensuring a good quality of life. Section 5. Genital herpes, long-term health impacts. While genital herpes is a lifelong infection, for most people it is more of a nuisance than a serious health threat. The virus remains dormant in the body after the initial outbreak, reactivating periodically to cause recurring outbreaks. The frequency and severity of these outbreaks can vary widely from person to person. Some individuals may experience frequent outbreaks, while others may only have a few throughout their lifetime. Over time, the frequency of outbreaks tends to decrease. While there is no cure for genital herpes, antiviral medications can help manage the symptoms, shorten the duration of outbreaks, and reduce the frequency of recurrences. These medications work by suppressing the replication of the herpes virus. It's important to note that genital herpes can increase the risk of acquiring other sexually transmitted infections, including HIV. Therefore, practicing safe sex and getting tested regularly for other STIs is crucial for individuals with genital herpes. Section 6. Protecting yourself and others. Preventing the transmission of HIV and genital herpes requires a multifaceted approach that includes education, awareness, and responsible sexual practices. This means staying informed about the latest health guidelines and understanding the risks involved. Open and honest communication with sexual partners about sexual health is paramount. Discussing your sexual history and any concerns can help build trust and ensure both partners are on the same page. Using condoms consistently and correctly during sexual activity is one of the most effective ways to reduce the risk of contracting both infections. It's important to follow the instructions on the packaging to ensure maximum protection. Condoms act as a barrier, preventing the exchange of bodily fluids that can transmit the viruses. They are readily available and easy to use, making them a convenient option for many. Getting tested regularly for HIV and other STIs is essential for early detection and prompt medical care. Regular testing can help catch infections early, making treatment more effective. Knowing your status allows you to make informed decisions about your sexual health and protect yourself and your partners. It also helps reduce the stigma associated with these infections. For individuals at high risk of HIV infection, such as those with multiple sexual partners or who engage in intravenous drug use, pre-exposure prophylaxis or PrEP is a highly effective prevention method. PrEP is a proactive step towards maintaining your health. PrEP involves taking a daily medication that reduces the risk of contracting HIV by up to 99%. This medication, when taken consistently, offers a significant layer of protection. Section 7. Treatment Options HIV. Antiretroviral therapy, or ART, is the cornerstone of HIV treatment. It has transformed the lives of millions of people living with HIV around the world. ART involves taking a combination of medications that work together to suppress the replication of the virus in the body. This combination approach is crucial for its effectiveness. This helps to restore and preserve immune function, preventing the progression to AIDS. By maintaining a strong immune system, individuals can avoid many of the complications associated with HIV. ART is highly effective in reducing the amount of HIV in the blood, known as viral load, to undetectable levels. This means the virus is no longer detectable by standard lab tests. When taken as prescribed, ART can significantly prolong the lifespan of people with HIV, allowing them to live long and healthy lives. It enables them to enjoy everyday activities and maintain a good quality of life. Moreover, studies have shown that people with HIV who maintain an undetectable viral load through ART have effectively no risk of transmitting the virus to their sexual partners. This is a significant breakthrough in HIV prevention. This groundbreaking finding, known as undetectable equals untransmittable or U equals U, has revolutionized HIV prevention and treatment. It has provided hope and reassurance to many. It's important to note that RT is a lifelong treatment, and adherence to the prescribed medication regimen is crucial for its effectiveness. Consistency is key to keeping the virus suppressed. Missing doses can lead to viral resistance, making the treatment less effective over time. Therefore, patients are encouraged to follow their treatment plan diligently. Section 8. Treatment Options, Genital Herpes. While there is no cure for genital herpes, antiviral medications can effectively manage the symptoms and reduce the frequency and severity of outbreaks. These medications are a crucial part of the treatment plan for many individuals. These medications work by interfering with the replication of the herpes virus, thereby helping to control the infection and prevent it from spreading further. Acyclovir, also known as Zovirax, valacyclovir, known as Valtrex, and famciclovir, or Famvir, are commonly prescribed antiviral medications for genital herpes. These drugs are often recommended by healthcare providers. These medications can be taken episodically to treat outbreaks or daily as suppressive therapy to reduce the frequency of recurrences. The choice of regimen depends on individual needs and medical advice. Topical antiviral creams such as docosanol, also known as Abreva, can also be used to relieve the discomfort of genital herpes sores. These creams provide symptomatic relief. However, it's important to note that topical medications do not cure the infection or prevent its transmission. They are only part of a comprehensive treatment approach. Managing stress, getting enough sleep, and maintaining a healthy lifestyle can also help to reduce the frequency and severity of genital herpes outbreaks. These lifestyle changes can make a significant difference. Some individuals find that certain triggers, such as stress or illness, can reactivate the virus. Identifying and managing these triggers is an important part of living with genital herpes. Section 9. The importance of awareness and early detection. Raising awareness about HIV and genital herpes is crucial for breaking down stigma, promoting testing, and encouraging prevention. Education and open dialogue about sexual health are essential for empowering individuals to make informed decisions. Early detection through regular testing allows for timely medical intervention, which can significantly improve health outcomes for both infections. Knowing your status empowers you to take control of your sexual health and protect yourself and your partners. By fostering a culture of open communication, respect, and support, we can create a more informed and compassionate society that embraces sexual health as an integral part of overall well-being. Remember, knowledge is power, and together, we can make a difference in the fight against HIV and genital herpes.